10, 20 years ago.
You would be surprised at what they wanted to do. Electronic, whatever, it's a cigarette.
In the later stage.
We would like to thank the Black Community Development, Inc. for allowing us to use this beautiful facility. We have a welcome from the founder of Better Community Development, Reverend William Robinson. He's going to come at this time to welcome us here. And then on behalf of Future Builders, Inc., we're going to have a welcome from our Board of Directors, Senator Linda Chesterfield. After which, we will get started with our program. I am Linda Conley, Executive Director of Future Builders, Inc. Thanks so much, all of you, for coming. We're going to have an awesome time today. So if you will, be patient with us because we're going to be moving kind of fast-paced. We want to get started on time so that we can end on time. So just be patient with us as we move along. I'd like to thank my funding sources before we get started. Dr. Miriam Evans-Lee, who's with Ms. Argo. Would you stand, please? And we have the health department. Do we have Brandy Roberts here yet? With the Arkansas Department of Health? Yeah. Okay, she is one of our funding sources as well. So we'd like to thank both of them. Let's give them a round of applause for making this possible. We're going to have some other acknowledgments as we move along. So at this time, I'm going to present to you Reverend William Robinson.
Good morning, everyone. Good morning. We are delighted to have you here this morning, and we know that this is a great day, and we want some good things to happen to come out of this meeting this morning. I want to thank Ms. Conley for the relationship between community developers and that great group from down the right, Youth Builders. I want to let you know where they're from. I want you to think that they're from here also. But the relationship we have is certainly one that has been great and been for some years now. And we want to continue that in this month of AIDS Awareness Month to really begin to lift and to regenerate some of the energy in which I think might have kind of gone away because medicine has done a great job. And I just was on the phone the other day with a person. The first person I met, well, the first female that I met, who was affected by AIDS, and she called me the other day, and we talked for a long time, and that was some 20-something years ago. So wow. We're just doing great with medicine, and we want you to know that there's a potential just to wipe this whole piece out, but it will only happen when citizens get involved and begin to push our Congress to make sure that they don't cut the research money for medicine and make sure that money is there to carry on and move forward. And we know that you come from whatever organization you represent this morning. We want you to go back and take the message to them, but don't just take it to them and leave it, and walk off from it. Take it and see to it and push and urge them along to make sure that they become fully engaged in how we eradicate this disease in which we have. So we welcome you for being here this morning. We know that it's going to be a great day, and we want you to leave here really highly energized so that we can go back and to be the best person that we can be in making sure that we cure this dreaded disease. So thank you for coming this morning, and may God continue to bless you, and welcome to BCD. When we started this vision here, it was about bringing community together, and that's what we're doing here this morning, bringing community together. And so if we don't get anything else done, we got you here to make sure that we move forward. Thank you for coming.
Good morning. Good morning. My name is Linda Pondexter Chesterfield, and it is an honor to be with you this morning. I have been blessed or cursed to be a part of the Arkansas State Senate, and this is in my senatorial district. This is a community issue. It is a community issue which must energize each and every one of us and make us move toward action. It is not enough that we have done well. We must do better. It is not enough that we are at least talking about it in company, because so often it had been relegated to the closet. We must bring this to the forefront at every Middlesex village and farm where we find ourselves, because lives are at stake. And in just listening to the news the other day, 40% of the new cases of HIV/AIDS are in the African American community. That is unacceptable. Risky behavior is unacceptable simply because we have better drugs. We need to make sure that we are indeed our brother's keepers, our sister's keepers, and say to each and every person that when you're risking your life, you're also risking mine. The quality of life that every human being deserves requires that we be responsible about our health. It is indeed the temple of the Lord.
That's right.
And so when we stop taking precautions, when we decide, oh, Magic Johnson's been around a long time, so he's okay. It's not okay. And so as we build the future of this community, let us determine together that we will do everything we can to enhance knowledge, to enhance awareness, to enhance the lives of our fellow persons. May God bless you this morning, and it is indeed an honor as a part of the Future Builders Board of Directors to welcome you to this great event. Thank you.
Well, thank you everyone for being here. It was good to see Reverend Robinson. I haven't seen him for 10 years. We go way back with some work that we used to do with the city of Norwalk. So my day has already been very blessed. I'm going to be your moderator today for all the events that we have or presentations that we have. So I appreciate that opportunity as well. My name is Debbie Rushing. I'm with the Arkansas Department of Health Tobacco Prevention and Cessation Program. So first up on our agenda is Lewis Henry and Curtis Jackson of UT Southwestern, and they are, oops, I should have marked my pages better. I had it marked a second ago and then I moved my thumb. Curtis is a senior program coordinator at the University of Texas Southwestern Medical Center at Dallas. And I'd like to invite him up. Oh, sorry. This is not working.
That is going into the recording because we're going to.
I'm sorry.
You know this, you're going to be on YouTube.
Oh, no.
We're putting this on our
Oops.
website. You're going to see your faces. I didn't mean
my
to
cup.
interrupt Debbie, but I wanted to say this because as moderator, she's introducing our speakers.
Okay, sorry.
And Curtis Jackson with UT Southwestern had an emergency. His daughter rolled her car 3 times. He's in the emergency room with his daughter. So Dr. Miriam Evans Lee is going to present with Lewis Henry. So these are our first 2 presenters, Lewis Henry and Dr. Miriam Evans Lee.
Sorry.
I did not share that with her.
Okay.
And that's my fault. And also, after, just before we get started, if you'll notice in front of you, there are some evaluation forms. And what I'm going to need you to do is after each presenter, I want you to evaluate that presenter, okay? So where you see Curtis Jackson, that's going to be Dr. Miriam Evans Lee, okay? And Joyce Rayner, raise your hand, is coordinating the evaluation piece. So,
and before you all rate those individuals, in order for us to know if we're just event is a success fulfilling, we want to make sure that we get the evaluation billed, not only just billed in part, but in its entirety. We're gonna sweeten the pot a little bit at the end of the day. If everyone, those who have completed the evaluation in its entirety, I mean, every question, every answer, there is a $25 gift certificate that will be pulled for. So keep that in mind. And there's one last thing that we want you all to do right now with your sheet. At the top where it asks you where's your occupation, when you complete that area, put if you are a smoker or a non-smoker. They're anonymous. And also, if you are familiar with the 1-800-QUIT line, that's all I'm asking you as you go through this entire day. And remember, you're only eligible for the drawing if you complete it in its entirety. Thank you.
Thank you.
All right. Doctor? Yes. Yeah. Okay. All right, so we're going to have Lewis Henry. He is an alumni of the University of Arkansas at Pine Bluff, and is currently with the concentration of organizational management at UT Texas at Dallas. And all right, I got a little switched up here. Let me find Miss Evans. I should know this by heart. She's the director of the Minority Initiative Subrecipient Grant Office out of UAPB, Pine Bluff. And she takes care of 15% set-aside funds for tobacco cessation and tobacco control. And has many, many projects that they do at UAPB that we are really excited to be partnered with at the Arkansas Department of Health. So, Lewis Henry.
So, good morning, everyone. Good morning. Everybody doing okay? Yes, sir. Okay, well, I thank you guys for being here. Because there was one day when we had World AIDS Day celebrations and it wouldn't be but 1 or 2 people in the room. So this is exciting. You know, 10, 20 years ago, nobody was coming out. And I'd like to thank the committee that worked on this program for inviting me. They called me at 10 o'clock, 9 o'clock at night and said, will you come and speak? And I said, well, if somebody's working at 9 o'clock at night, calling me to come speak, I said, well, I guess I don't have too much of a choice. So what I'm going to do today, what we're going to do is talk about the new CDC initiative and how that should work. And so we're going to go through it. We're going to do a Weight Watchers version, a post-Weight Watchers version, so that means we're already skinny. So we're going to go through it fast. But if you have any questions or anything, we'll have question and answer, and then I can give you my information, and we're always available to come back out. What we do is provide training and capacity building. We're funded by CDC to provide that service up until April 1st. So get it in and get it, before things change. So if anybody needs anything, we can always come back and sit down with you and walk you through these things or talk you through them on the telephone. So, can y'all not hear me?
I think that goes through to your recording, is that correct? Yes, you need to use the mic.
So you have to project. Can y'all hear me? But y'all can hear me from this mic I have on, right? Yes. Okay. So what we're going to do is talk about HIV prevention and what works, according to CDC and this new initiative. And what it's called is high impact prevention. And what happened is high impact prevention came from the National HIV Strategy. And so what happened is that from the goals inside the strategy of the HIV strategy is where the actual high impact prevention came from. It correlates with that, in order to allow the executive committees and the people, the powers that be in Obama and them to reach these goals. And the actual goals that of the strategy is to reduce new HIV infections, to improve health outcome for people living with HIV, to reduce HIV-related health disparities, and to achieve a more coordinated national response. So those are the 4 goals that's in the strategy. And what they focus on as it relates to HIV prevention is the first thing is about the actual population. And the populations that was pulled out are the people that are at the greatest risk were gay and bisexual men of all races, African Americans, and Latinos. Those were the top populations. And the next part of that around prevention, I'm reading this because I want to make sure I give you the correct information, was around proven HIV prevention interventions. So, and a lot of people may be doing those interventions and those programs now. That there are 8 programs, and then they also look at evaluate how effective those programs are and the cost of those programs. So those are 2 pieces, is that looking at the 8 programs and then also looking at if it's effective and the cost of it, how much it costs to deliver the program. So I'm gonna go through the 8 components. The first component is targeted HIV testing and linkage to care. The next one is prevention programs for people living with HIV and their partners. The next one is prevention programs for people at risk for HIV. The next one is antiretroviral therapy. It's a little bit different coming from CDC, you know, and within this prevention thing. And I'm gonna walk you through some of that and show how all that should be working together. The next is substance abuse treatment, access to condoms and sterile syringes. And the last one is screening and treatment for other STDs. So what we're going to focus on today is prevention with positives. And what happened is that 3 years ago, we were funded by CDC in order to produce what they call the Prevention with Positive website. And I'm going to walk you guys through that website and actually go through the components. There are 10 components. So what happened is we had the National HIV Strategy, which brought on high impact prevention, and out of it, high impact prevention comes prevention with positives. It's a piece of that. It's not all of it, it's a piece of it. So, and what we're gonna do is to actually walk through that. And so the website, and I have some cards here on it, but if somebody want to write it down, it's www.hivpwp.org. hivpwp.org. And so what happened is that it jumps a little bit too. So PWP in action is what I'm going to talk about later on at the end. That's a graphic novel that shows how this whole process should work and how those 10 components should be incorporated into the community. Then on the website is another piece. This is a 1 hour training for clinical people, for physicians and other clinical people, in order to kind of walk them through this change of actually doing prevention in a clinic setting, which is something very, very new to a lot of clinical providers. So, and it's a 1 hour long, and it also has, you can also get CEUs by going through that. And I have a card, and I'll give you those cards at the end so you guys can take it with you. The next thing we're going to talk about are these PWP components, the different components in PWP. I like the other page, but so, and I'm going to talk about them kind of briefly, because you guys can go back to the website and look at them. But the first one is linkage to care, where from testing that people are linked into care. And a little bit more goes on with that. It's another piece down there, but also other services if needed. So, and when we said linkage to care, we don't mean that we take them and we call and say, okay, you have an appointment. That's not linkage to care. Linkage to care is making sure that they get into care and that they are stable before the linkage person pulls out. So they should be in there making sure that all the questions are getting answered, anything that the client needs at that time in the, the first 6 weeks to maybe 3 months. One of the interventions that CDC funds is ARTIS, and it's designed around linking people to care. It actually teach you and take you to linking people to care. So the next component is retention in care, and that's keeping people in care. The next is screening for risk reduction. And the next component is partner services, antiretroviral treatment. So we hear that word again. Adherence to the treatment. So getting to the appointment and actually doing what's supposed to be done, or what the doctor and the patient come up with, whatever they collaborate with, whatever they come up with, that's carried out. Sexually transmitted disease screening for STDs, referral to other services, whatever they may be that's needed for that participant. Reproductive health care and mother-to-child prevention, which we don't see a lot of, but it's still there. So when you hear all those, that's a lot. That's 10 components. And I want you guys to think, how do you think that one program can do all 10 of those components? They can't. It is essential that we collaborate. It is very important, if you're going to continue to get funded under HIV prevention, is that there is a collaboration, because one agency 9 times out of 10 cannot do it. And so what happens is that in that collaboration, the health department, the CBO, and the clinic, all 3 working together. And there's some challenges in there. One is that we may not have worked as tight as this is needed. That's one challenge. The next challenge is how do we release information to the CBO when we talk about someone who's out of care? How do we give somebody's name? How do the clinic give somebody's name to a CBO that's been funded to go out and bring people back into care? It's a big challenge, you know, and getting around the HIPAA piece of that. But they have to work together. And the thing is about it is that this process is going to look different in every community. Every area is going to look different because the players are going to be doing different things and funded to do different things. So it's going to look real different in different areas. That graphic novel will show you what it should look like in the perfect world, but I don't think it's going to look like that. There's going to be some jagged edges, and we're going to have to work through some things. So, you know, that's one thing, is how the CBO will get that information from the clinic or whoever that provider is that's doing retention to care and bringing people that's lost to care. You know, and that's a hard piece, you know. So the next thing you say, well, how does the health department play a role in this? Well, the health department, one of the biggest things is that when we look at the main goal here is to reduce the viral load, the community viral load, which means that we want everybody's viral load to undetectable. Because if we get everybody's viral load to undetectable, then that means that there's no viral load, and that reduces transmission. So health department has those numbers. They come from the clinic to the health department from the viral load testing. So they know they can determine what it is. It's a collective of all the people within that area that are living with HIV and where their viral loads are. So that's where the health department plays, the STD screening, and all of the collaboration goes together. So all three of these people have to collaborate. And not only do they have to collaborate, but they have to be willing to collaborate with the community member. The biggest challenge there is getting the buy-in, is that it's going to take trust and relationship. If we don't build trust and relationship, it's not going to work with the community members. And not only one person, not only the CBO, but all three of them. You know, so we have to kind of not just look at them as a patient, but as a person, and if we want people to come back, you know, because that's one of the biggest things in retention to care. So that's how all this in a quick nutshell should work. And so what happens is that if we get to this with these three people doing those 10 components, which I didn't kind of relate them all, work together, it reduces the viral load, which, what happens in the strategy? Right. And then what's the theme for World AIDS Day? 0. Okay? So that could take us there. But we have to. It is essential that everybody in this room and everybody that's not in this room is a part of that collaboration. Because whether that community member is infected or not, if they're just affected or they know somebody, I mean, it's going to take all of us. So you can go to the next slide. And so again, this is the website. And in that website, you can see the graphic novel that shows how those components work. They're for clinicians. Well, anybody can take the training, but it's geared directly to mostly physicians and nurses about prevention with people that's living with HIV. So, and that's my information. And when Dr. Lee finishes, we're going to have question and answer. So if you guys jot down any questions that you have, you can. Is my time up? Because I could talk some more. Oh, I guess so. They ready for me to go. Also, what I did is that, what I have here is I have a sheet that says request for information. If you need any more information from me, if you sign this sheet and put your information on it, I'll get it to you. And they're laying here. Oh, she's waiting.